Okay, welcome then to this 45-minute session, which introduces Health Business Elite on EBSCOhost, featuring comprehensive journal content, including full text access to the Harvard Business Review. So to formally introduce myself, I'm Richard Crooks. I work for the EBSCO Customer Training Services team based in the UK, and I'm a senior customer training specialist supporting libraries in the UK, Ireland, and Nordics. I'm a chartered librarian. I've been with EBSCO now for more than 14 years, previously working as a medical librarian for 12 years in the NHS in England. So welcome to the session this afternoon. In terms of the objectives for this session, my hope is that by the end of it, you'll be able to perform a natural language search to find full text articles. You'll be able to combine searches for more in-depth searching. So we go through the steps of that in the live demonstration. You'll also be able to save, share, and download search results, browse and search within specific journals, and also set up search and journal alerts as well. So that's what you're expecting from the session this afternoon. So in terms of this database, which is available on the EBSCOhost platform, you have access to more than 600 full text journals and magazines, of which more than 280 are actually full text. We'll see some examples of those in the subsequent slides. So the subjects covered include computer technology, facilities management, hospital administration, hospital management, human resources, insurance, marketing, and more. So you're essentially looking at a non-clinical complement to the likes of Synel Medline, obviously particularly relevant to senior management within health services and so on. So in terms of the key titles that are available, note that these are ongoing or current full text journals, and there's no embargo for these titles. So in other words, you have access to the latest content, latest full text content for each of these publications. So you have, for example, the Academy of Management Journal, the Academy of Management Review, Administrative Science Quarterly, and there's more, of course. Again, these are ongoing, current full text with no embargo. Again, you'll see Forbes there. Harvard Business Review, I just mentioned as well, key title for senior managers within the NHS and other related organizations. Healthcare Executive, Healthcare Financial Management, and Journal of Business Continuity and Emergency Planning. Also available full text with no embargo. And some others there that you might recognize: Journal of Business Ethics, Journal of Communication in Healthcare, and so on. And there's more, including Modern Healthcare. That's been around for some time. Nursing Economics as well. And a few more titles here, even PC World and Pulse as well. So again, these are all available full text titles with no embargo, so you can get access to the latest content, coverage, etc. Now, for those who wish to know more about this database, particularly the subject journal coverage, we do have accessible links here. So for the Excel file or HTML online viewing, you can see those highlighted on this page as well. So this is the public-facing page on EBSCO.com in relation to Health Business Elite. So just a brief overview there of this particular database. So we will now go to the live demonstration. So we will run some searches on this database. So let me now switch screens here. So I'm going to do that now. So you should now see the advanced search page, the default landing page for this database for EBSCOhost, so the EBSCOhost platform. So we're going to run some searches on this shortly. So just to show you around the platform itself. Okay. So we've got the interface here. So we may have defaulted the basic search screen. I think in my experience, especially supporting the NHS in the UK and also the HSC in Ireland, the default landing page is typically advanced search. That allows you to perform standard or basic searches, also to enter search terms, combine them using Boolean operators, and specify certain field codes where you want to search specifically within, and also applying various filters that are available, including publication type, publication date, and so on. And just to inform you, in terms of the standard search, the basic search, you have these search options, this tab here on this page, and you'll see the default search mode for searching on Health Business Elite, and pretty much most EBSCOhost databases, though not all, is the proximity search, which means that words are typically searched in any order that you enter them. Okay, and within a specified word range, which is typically 5 words or less. I can say more about that. I'll direct you to more information as needed. So we have got the EBSCO Connect Context Sensitive Help menu. So if you click on that link, that will take you to the EBSCO Connect page, and that will give you more information about the search modes. As you can see here, this is the default search mode. This can be reconfigured in our EBSCO admin tools, as it were, but by default, it will search for the terms. For example, web accessibility, web N5 accessibility, it means it will search for the word web near 5 words or less of accessibility, as well as accessibility within 5 words or less of web. So again, in any order. Okay. Now we do have natural language search as well, and you'll see more information available on this. But this is an AI powered tool. So basically, a large language model is prompted when you enter your query in the form of a question or a statement. So just to illustrate that, if I go to advanced search, you'll see we have the search mode natural language search here, and then we can enter a query above. So for example, if I enter, what is the impact of Gen AI, let me get it right, on the healthcare workforce. Okay, so it's in the form of a question, and so I can enter it just like that and click search. But again, I need natural language search mode selected to ask that question, and then you'll see the results below. Now, there are a couple of things to point out here is that you'll see we've got all the results where the keywords are highlighted in the title, and also the keywords that we entered in our query have also been, highlighted in bold in the abstract, in the subject fields, and so on. So you can see the relevance of these documents, these publications, as it were, these articles, and so on. And also, one thing to note here is that it also prompts you to consider other questions that you might want to ask in relation to this. So although I put in what is the impact of Gen AI on the healthcare workforce, notice it's saying how is generative AI transforming roles within the healthcare industry, and so on, or in what ways. So it's basically giving you 3 alternative questions that you may want to ask. So for example, what are the potential benefits and challenges of using generative AI in the healthcare workforce management? So if I click on that, it should rerun the query. Okay, and it doesn't bring up the results there. So again, you can play with this. Obviously, I can go back to my original question, which I will do so. And by the way, you'll see the search history is on here. So the search history will display when using the advanced search screen if it's been enabled in our EBSCO Experience Manager tool. So in this instance, these tools menus do give you the option to delete a search string. So I don't need this now, but I will focus back on the original results that I saw. So let me just see. Let's go back. Okay, the original query. Okay, so I'm not sure why what's going on here. Something's a bit bizarre. Okay, let me just go back now. What I'm going to do here, that is from the advanced search page. However, you have got the basic search, and you'll see natural language search is available here. So if I ask the same question, okay, workforce, then I can run that search. And this time, because I'm running it from the basic or standard search screen, you'll see there's an additional couple of features here as well. The first is how does it work? So basically, this just informs users. It's going to be a senior manager, non-clinical staff in the NHS who are using this. It just explains what this natural language search is. So it's basically AI powered. And if you want to know what the actual query is that's running, you can see show refined query here, and it gives us the Boolean query. Okay, so combined with or and. So we've got Gen AI, generative AI, or artificial intelligence, or machine learning combined, and with healthcare workforce, healthcare workers, or medical professionals, and so on. And an impact, effect, or influence, or consequence. So you can see clearly how the model has responded to my question and constructed a query, a Boolean query, to run the search. So it's quite explicit as to what it's doing, etc. Okay. So you'll see those results there below. Okay. And of course, you've got these results. We've only got 17 here, so not too many, but you can filter more specifically. So for example, if you want to go to the dates, you can view what was published in the last 12 months. Obviously, this is very topical. Excuse me. And you'll see that these have been published in the last year. So this is Healthcare Dive there, Health Marketing Quarterly, and so on. Health Affairs. So these are all very current. Journal of Healthcare Management, etc. And so on. So it's a very recent publication there. Okay. And of course, if you want to see the full text, you can just select full text here as well to refine it further. And 5 of these are full text, either online, as you see this one is, or by PDF online full text as well. Notice also we have this online, this more like this feature, this button here. If you click on that, it will generate up to 5 references which are related to this particular topic. So based on the metadata that EBSCO holds, and you can see about this recommendation here, it will prompt further articles which may be of interest to you. So you can see this one here, somewhat long-winded that title there, but we've got this item. You can indicate if you feel it's relevant or not, helpful or not, yes or no. Again, you see this one has PDF full text. You can view the details as well, etc. and so on. Okay, so it does prompt you to see or check other articles, and you can go to the next one and so on, etc. So again, it's your call whether these are relevant or not, and so on. Okay, so just a brief introduction to an option that you have using natural language search mode to ask a question. It could be in the form of a statement, but to generate results from this database specifically that are very quick. Okay, and again, you can see the refined query to indicate the relevance of that in terms of how it's interpreted your question. Now, if we go back, if we go to the new search here, what we'll do, and what I will do also, is need to clear up my screen. So in a moment, in fact, let me go back to that now. I'll just go back to the search. And in fact, we cannot see it now. So, okay, on new search. So in a moment, you'll see the search history. So when I run a search, then you'll see that displayed, and I'll tidy that up. So that is natural language search mode. However, you may want to go a bit further and combine terms. So I have an example that we're going to look at today, and that relates to staff shortages, healthcare personnel, and so on. So what I'm going to do here is enter my query in the search box above. So this is very similar, almost identical to what you'd do if you're searching CINEL or Medline on the EBSCOhost platform. So this will look very familiar. And what I might do here is also, I noticed another one selected, not sure why that was. So you can see I've got a demonstration site. So I'm going to just select this and come to this page again. So we're going to put in staff. It could be staff or staffing or staffed. So again, I'm going to truncate that using asterisk. So basically the truncation is the asterisk, and that allows you to search for words with multiple endings. I'm going to add personnel. Okay. And or employees. Now, you may wonder, I've got these Boolean operators or here in uppercase, and while it's not essential that you have that, it's generally a better approach because otherwise it could interpret it or as a stop word and so on. So again, you might want to be mindful of that. Default to using the and or even not in uppercase. I typically do that. There is a setting in our admin tool which can mandate that, but that is something which may or may not be enabled. So, okay, so we've got the staff or personnel or employees here. I'm going to do an unqualified search. I could, of course, qualify that by specifying a field, for example, the title or abstract field with XB, but I'm going to leave that off for now. I am going to add other terms here, though. So, for example, we're looking specifically within the NHS or National Health Service. So I'm going to add NHS or, and I'm going to put National Health Service in double quotation marks. So that ensures we find at least one occurrence where that phrase, National Health Service, which is typically associated with the UK, is mentioned. Okay, so I think I will leave it as that for now. Okay, so we're combining these two sets of terms, the 3 above and the 2 below, using the Boolean and. Of course, you've got not there if you want to exclude some as well. And what I can also do here is, let's see, we can also filter by date. Immediately, if we go to the publication date, we can perhaps go for the last 10 years. Okay, or you can specify a date range. So, for example, we could enter a year here. So if I put in 20, let's go for 2020, 2020 since the pandemic or around the pandemic time, and then today. Okay, so we're now to April. Okay, but I can just put in 2026 and it will default to whichever the year is better. So let me just do that now. Okay, so you see 2020, 2026. Typically, it's from January 2020 to December 2026. So if I run that search now, then in a moment, you'll see when the results appear, okay? You'll see now a couple of things. First of all, I've got my search history still displayed, but obviously I don't want to keep all these other sets here. Now, there is going to be coming a bulk delete option on this page where you can select, for example, I can select these, deselect this one, and delete all these sets. Now, that's not released yet. It's coming soon. So what I would need to do in this instance is just delete line by line right now. Okay, so again, that's going to change. You have a bulk delete option for this. So I can go in and just remove my former searches. Okay, just take these away. Okay, and then this one. And then final set there. Okay. So what I'm left with, of course, is that set where I just perform the search. You can see it's combined. This is S1 with staff, personnel, etc. You can see the search options includes the date range, which I customize. So that's from January 2020 to the end of this year. Of course, it would be April. And you can see we've got the proximity search mode on and apply group subjects, which is an expander tool, which allows you to be mapped to the appropriate concept, and then in turn it will map you to the control vocabulary term, the index term from within this database. So that expands your search to include results that are based on the indexing of articles. And if we scroll down, you'll see we've got, for example, this article here, and then you'll see things like national health services, personnel, employees mentioned as subjects, as index terms associated with this record. Likewise, with this one, you've got National Health Service, obviously rates of Great Britain specifically there, and so on. So basically, it's possible when you do an unqualified keyword search, when you're not applying the likes of HBE title or abstract search, you will be directed to the appropriate subject as well. So in other words, it's going to retrieve records based not only on your keyword searches, but on what's been indexed and how it's been indexed as well. So I hope that makes sense. Again, I can refer you to the EBSCO Connect help menu for more information on that. So we have our results below. Also to note, in this search history, it does detail the database we're searching. So had I not deselected sport discus, that would also appear here as well. And then the three dots there, you can edit the search itself. If I go in, click edit search, and I can, for example, add another. So we've got staff, personnel, employees, and I can even add or nursing and add. So I can truncate, that's nurse, nursing, etc. And I can update my search, and I'm not sure why that happened. That should work, by the way. So they have to report that. That was a new feature, by the way. We can edit the combined search queries. So that was new. So unfortunately, on this demonstration site, there appears to be a bug. Okay, so we've got the results below. Now, obviously, once we've run the search, we want to process these records. Now, the first thing, of course, we may want to apply further limiters or filters to this. We have got, for example, here, full text, peer reviewed. We've used the date range already, and we've got source type. So maybe we don't want the news magazines. We want something more authoritative. We could have academic journals and maybe reviews and apply it here. So we just filtered now. So we reduced it almost by half, 343 references. Obviously, the one at the top there, which is considered the most relevant based on the algorithm that we have. So you see relevance here, and that is a systematic review. Okay, so again, understanding why health professionals are leaving the UK NHS, etc. So pretty timely and current. It's April 2026. And again, you can view the abstract there as well. And if we go to all filters, there are other additional options that we can apply. And notice on this column, you'll see we've got the filters already applied currently. So we're looking at academic journals and reviews that have been published since 2020 to the present. We've got applicant subjects as an expander on, and we've got other options there. So we've got the subject fields is here, as you can see, United Kingdom and National Services. If you click more, then we can factor these in as well. So you can sort them alphabetically, by the way. So for example, A to Z, and you'll see here these results. So you've got Great Britain National Health Service. So this again is what we want. England, of course. Let's see what else is here. Ireland, of course, is mentioned there as well. And National Health Services, that could be a bit general, could be about other national ones, but we've got those there. In fact, we've got United Kingdom here as well. So United Kingdom. So again, we can factor these in as subject headings to retrieve results based on the indexing of content, which may be more reflective or more relevant references. Okay, so if we're satisfied with that, we can just go for that for now. So click Update Selections. We've got publication. You can see the publications coming from, including Nursing Management UK as well. Notice that there. So again, we'll look at that again in a moment, and also the publisher content as well, including the Royal College of Nursing, etc., and so on. So we're just going to click Apply here, apply those filters, those additional filters, and in a moment you should see that appearing. And notice also in the search history, those filters are accounted for. So you can see how we've filtered. And if you want to see the search history in a sequence, as opposed to reverse chronological order, just click the ID link above, and you'll see now we started with 617 references. We've now got just under 200. And again, you can see the one that's still relevant, of course. This from the, again, Journal of Health Services Research and Policy. We've got Journal of Healthcare Administration, again, quite recent, and so on. There's studies there. International Journal of Healthcare Management. So again, this rates the NHS there, of course, and so on. So again, these are, again, articles published in journals, reviews since 2020. So pretty current. So what we can do with these, we then may want to look at them further. If we have any full text content, for example, this one, item 2, or if we go on further, item 3 has several options, PDF and online full text. If you go to the PDF article, again, any comments or questions about any of this that we're looking at today, please do let me know. You'll get the native article, the electronic reproduction of the native article. And within this page, you'll see we have various options. You can use the save ribbon to bookmark that, to save that. You've got the cite tool here, which allows you to copy the citation for this article. So we've got Harvard referencing on, so you can copy that to the clipboard if you need to cite that in any way, or refer to it maybe to a senior manager in a Teams message or chat or email. You've got the export citation too. So you can export in RIS format as well. So if you're creating a bibliography, maybe on behalf of a senior manager, then you can do that. Or if you're advising how to do that, you can share this information with them. RefWorks also is there, EndNote Web. Okay, so that's the cite tool. We'll come to add to project in a moment. You've got the share icon as well. So we support Google Drive, OneDrive as well. So if you want to save it to OneDrive, if you just want to create a link and forward that link to, again, one of the healthcare administrators, then you can copy that. Obviously, this will be linking to the full text document, and then need to authenticate into that as would be normal for your institution. And then we have the email option, which has been enhanced recently. So there are additional options here. Note also that because the PDF and online full text are available, they can be included as an attachment. You can enter your email address or that of the recipient who it should go to. The preferred display is here. So brief citation can include the abstract, but we also support the detailed citation now, which means you can specify the specific fields that should be seen when you send this article. So again, it may be that your managers would like to know certain things, for example, the language, maybe the ISSN and the ISBN, if it's an ebook, for example, they might want to include the abstract. So whenever you send the file in this way, it's going to include those fields specifically, and you can untick ones which may not be so relevant, for example. Okay, and you can send accordingly. That's a new feature. And in addition, again, so we've got those 3 features, the brief citation, the citation format, and the detailed citation there. Now, you can also download the article itself. So if someone wants to read it offline, they can download the PDF or online full text, or if you just simply need a reference, you can download the metadata only in PDF, Word, CSV, BibTeX, or XML, Mark 21 as well. So you can download the preferred format. You can also, of course, print. We still support printing articles for those who prefer to read them as a hard copy or even save as a PDF. You can see that there. And we also have this publication contents link also, which allows you to browse other articles in the same journal, which again might be of interest to senior managers and other healthcare staff. And then we also support the text-to-speech functionality, again, improved accessibility and for ease of access to this article. So in other words, you can listen to it being read online while you're multitasking. You can also download the MP3 to listen to it at a later date if need be as well. And then finally, for enhanced accessibility, we've got this accessibility support icon. This is where a user can request an alternative format to what's already available. So if we scroll down, you'll see we've got Word here as well. And online is already available actually, but Word is an alternative format that may be a better format for those with accessibility issues and so on. Now, there is a caveat to this that basically this content is available within 3 to 5 business days. So whereas you can access the PDF now and the online full text right now in real time, there will be a delay while the alternative format will be produced. Okay, so just bear that in mind. But again, it supports accessibility for all user groups and so on. So again, any comments, questions about any of this, please do let me know in the Teams chat. And if need be, I can unmute you if you select the raised hand icon. Okay, so that's the sharing there. Also, if you go into, and let's go back now to the online full text. So just to say, show you that this is the same article in HTML format. You do have the contents, the table of contents there, so you can, navigate easily to the appropriate section for ease of reading. Again, you might want to advise your users of this. So if you want to see the conclusion, you can jump to it there. We also support text-to-speech software for online full text, as we've always done in classic EBSCOhost. The PDF one is new, so you can list it being read online. You can download the MP3 and also change the text highlighting, word color, sentence color, and so on. Okay. Now, there's another feature of this. Now, since content here is generally available in English, you wouldn't need to translate it. But if someone wanted to translate it to their own language, there is the machine translation icon, and you can translate it. For example, and we think of the nations we're in, we've got Welsh here, so we can translate it to Welsh. Likewise with Gaeilge for Ireland and also for Scotland. So possibly for Scotland, I'm not verified that yet, but Welsh is certainly available, so I'm just going to wait for that to complete, and you can see that now translated. So if you're a native Welsh speaker, you'll know whether or not how accurate that is. We do hasten to add, it is a machine translation, and it is provided by Microsoft, as you can see on the right-hand column. Okay, so again, it's a handy tool for those who wish to read it in their native language, native tongue, etc. So we can switch back to English here. Okay, otherwise the other tools are the same. So the cite tool here, again, you can choose the citation format. So that can be configured, by the way, to your preferred reference style. So typically, for example, if you have APA PsycInfo, you probably would default to APA 7th edition, etc. And for some Medline, it may be Harvard, and for that database, it could be Vancouver, Chicago, and the export citation is here for this individual record as well. And then the share icon is there again for Google Drive, OneDrive, creating a link to this HTML article. So if it means it's more appropriate to send someone an online full text article as opposed to PDF, you can then copy that to the clipboard and forward accordingly, or you can simply, again, email both formats, choosing the appropriate preferred display. Again, you can download the article as well, but obviously PDF is recommended for downloading for desktop access. So that's the individual articles. So where available. So just moving on here. Okay, so in terms of saving references, then I'm just going to hide the search history here, by the way. Then you have the bookmark or save icon or save ribbon adjacent to each record. Okay, that will save it into the save folder, or you can select at the moment 50 items at one time and bookmark them. Now that's changing. Come about June time, you will be able to save up to 500 references, not 50. So that's a big leap forward, which has been asked for some time now. It's going to be implemented in the summer. So if you want to then see where these records are stored, they're in the save folder on the left-hand column, which you see here. It's appearing in a moment. And one thing to note, that when these load up, you are prompted to create an account or sign into a MyEBSCO personal user account. That's if you wish to save them beyond the session. Now, of course, you can select these records. You can download this list in a choice of formats. So if I go for Word, for example, and download it, so you can do that immediately. And I'm just going to say it where I can, and then open this up so you can see what that would look like as a Word document. So just drag this. So this is now the Word document of these references. So maybe you may be creating reading lists for your colleagues in the NHS or other organizations. So again, this presents you with the Word format, including the links to the actual reference as well. So that's in Word. So you have a choice of formats to download items to. You can also do a direct export from this page as well. So if you want to export into RIS format or for reference or NoteWeb, you can do that and generate the file for it. So basically, though, if you want to keep records beyond the session, then you would need to create the account to MyEBSCO. This is your personal user account. We do support Google signing, by the way, but for MyEBSCO, then enter your name. Last name is optional, your email address, create the password, note the criteria, agree to the consent form, and create the account. Once you've done that, you can then click sign in, and then you can then sign in, and you'll find you're taken back to the save folder. And then within that, that placard has disappeared when that appears. So now you just focus on the results. One thing to note here as these results or records appear on screen is that because I'm signed in now, it's going to collate those recently saved items. And I don't know what's going on here. There's some bug. Hopefully this will rectify it. It will append those records to the previously saved results. So I've got 948 here. So typically what you might want to do is deselect or unsave records previously saved or move them to a projects folder. I'm going to show you how to do that. So at the moment, what I could do is simply click the save ribbon and that would unsave each of these records. Or what I can do is select all and I can unsave 50 records at a time. Now you can only see 50 records at a time currently. So if I click the unsave option there, then obviously going to bring down the number of records I've got saved currently. So there are options to unsave records that are already saved, as you've just seen. Okay, the bulk delete option for this is coming, I believe. So again, at the moment you can do 50 at a time. Okay. Now another thing you can do with save records is actually, and I'm going to go for the oldest, newest. Yeah, so these are related to previous searches that I've done. Okay, so it's newest. So yeah, I won't have time to delete all these because I'm doing 50 at a time. But you can move things. If I select one of these, okay, I can add this to a project. And I can save it to a project, or I can create a new one. So a project is a custom folder that you can use to store searches and references to collect them together. So what I would do here is go in here, add to project. I would set up a new project and I'll call it staff shortages in the NHS. Okay. Now, if it's something I'm working on in behalf of a manager, healthcare manager supporting them, or senior nurse, or another healthcare professional, then what I can do here is simply assign myself a date. If I have a deadline it's due by, so for example, by the 1st of May, I can give it a description who it's for, and then create that project. So I'm creating the project at the same time I'm moving those references, or we'll move that reference, sorry, to that project. So if I go to the left-hand column under my dashboard, you'll see I've got this project now, staff shortages, and I've got this record saved there. Now, of course, it's related to cancer, not what I was looking for originally. So you can save items and then move them to a new project you can create on the fly. Now, it may be better, and I generally recommend this, if we go back to the save search, to the search, that on the result list page, we select these references. And again, currently it's only 50 at a time, but I can select these and I can add them directly to the project and add now. If I go back to my project, so I'm bypassing the save folder, you'll now see within this project, I have those records also available. Expect that to click. Okay, again, it's just been a bit buggy today. There, as you can appreciate, a lot of enhancements coming to the interface as well. So there are ongoing developments taking place for this interface in preparation for the NHS to migrate to the new platform. So if you don't work in the NHS, you may already be accessing this. But if you're in the NHS, this is something which is coming in the summer. So you can see now I've got those records, 51 records now stored here. So generally speaking, I would advise creating a project either beforehand or on the fly, and then saving records to the project, add them to the project rather than saving them and then having to move them from the save folder. But again, that option is yours. Now, what you can also do is, if I go back to projects here, you'll see some examples of other projects. For example, this one I did previously. If we go into it, you'll see the save records. Again, records moved to the project or added to the project directly. Okay. And then also associated with that, well, there isn't this time, you can add a search. So if you want to add the search to this folder or the other folder, go back into my search history, my search page, results page, and then I can save the search here. I can change the name because by default it gives you the query string. So if I put staff shortages in NHS, I'll put health business elites. I know run it on that database. Okay. I got a description I want to do. I don't have to save it. Click close. So I have to save it to the save folder. If I go back to saved under my dashboard on the left-hand column, then if I go to my searches tab, you'll see it's now here. Okay, so this is the saved search, includes the date range, the subject filters that are applied, etc. And what I can do here is select this, add to the project, choose the recently created project, this one, and add now. Then if I go to my projects folder, choose the project title, so staff shortages in the NHS, and not only have I got the records stored there for reference post session and future sessions, I've also got the searches tab, and you'll see my searches here. So what I've done is just group the save records with the search in the project folder, so it's easily accessible. So again, whether you're doing it on behalf of a healthcare professional, non-clinical healthcare professional, or whether you're, training someone on this and showing them what to do, this is one way of doing it. Okay. So again, if you've got any comments or questions about these elements, please let me know. And again, you can also delete things, so you can delete the search here as well from this page. If you go to projects, you can actually go in and delete. In fact, not here. Let's see, actually here. You can delete the project and you always get confirmation if you don't need that. So I'll click delete. Yes, don't need it anymore. Okay. So again, they're going to be some changes to this page as well. Now, if I go back, thanks, Catherine. Thank you for that. If I go back now, as well as saving, downloading, etc., I also mentioned the search history. You can download the search as well from here. So if I go resort again, you can go to the download option, choose the format. So if we go for PDF in this case, click download. So I'm downloading the search history. I can save this and then just to open it up so you can see it. So this is the downloaded search history. basically. Now, this is going to be tidied up. There's some work going on behind the scenes to improve the clarity of this, but basically you've got the set number, you've got the query, you've got the date it was run, so this will be localized eventually. The results, so the hit count, the search mode expander it's on, and also the date filter also included, and of course the platform, which is EBSCOhost, and the actual database Health Business Elite. So just for reference and for reporting purposes, that information can be downloaded, etc. Okay. There is a CSV option too. So if you prefer to have a table of this particular page with those details, then you can also download that as well. Okay. Now, another thing you may want to do, besides saving references, you may also want to create an alert to them as well. So I appreciate we did start a little late, so I'll move on here. But also within this page, the tools menu allows you to create the alert. So the alert is a search alert. So in other words, if we want to be alerted to more references going forward in the future, then we can create this alert. Again, give you the same name. Okay. And you can specify how frequently do you want to receive notification of new content or the search having been run. So it could be daily, weekly, or monthly, daily by default. And when you set this up, it's valid for 1 year. If you allow it to continue, it will prompt you about 30 days for it's due to expire if you want to renew that. Okay, so you will be forewarned. It won't suddenly stop and you stop receiving those alerts. Okay, so you create the alert, confirmation on screen that you manage this from within the My Dashboard, so the alert section. So if you go to alerts under My Dashboard, you'll see we've got the search alert here. Okay, and you can go in the future and you can also view results of that alert, most recent ones, and you can go in and edit it. So if you now want to say only monthly, then you can do that. And notice if it's due to expire, you have the option to renew or extend or renew the alert as well. And of course, you've got the option to edit the email address it's going to. So this is something you can set up for your users, your colleagues in healthcare management. In other words, you're running the search for them, and you can also feed them with more information, more results when the search is rerun without you having to do more work. Okay, so that's a search alert. In addition, we have journal alerts. There's nothing here right now, but what I can do, if I go to Publications Authority, this will give you a list of the index publications within Health Business Elite. And remember, there's a number of publications that are available full text with no embargo. And one of these, of course, is the Harvard Business Review. So if I search for Harvard Business Review, you can see it's available in HTML and full text and PDF format. I can click on that link. Notice that I can also search within this publication as well. So for example, if I'm looking at change management, organize, so let's go for change management. Okay. I can search directly within the Harvard Business Review and it will generate results in the results page for that particular journal. So these 99 results are all in articles that have been published in Harvard Business Review, etc. Okay. And you can view them, the full text. Okay. If we go back again to Publication Authority, again, we'll look for the same journal, we just for sake of time, and you'll see you can browse the issues as well. If you want to browse them, you can. Again, advise your users of this, but also the tools menu allows you to create a journal alert. So basically what it means is when new content is published, you'll be informed of it. Okay, so you can see here the date where it will be created, and you just create the alert. Okay, and close to view that new alert in the alerts folder under My Dashboard, and it's there. Okay, so it will notify yourself or the recipient as to new content. So you can go in and edit the alert if you wish to. So if you wish to change the email address, you can do that. So that's a way to be notified of the latest content of a publication within Health Business Elite. Okay, so I'm just going to double check we've covered more or less what we plan to do. So you can browse and search within specific journals. We've got the online help here as well via the landing page. So this is generic to all EBSCOhost databases, but if you want information on, see, using the dashboard, for example, which I've just gone through with various elements, there is information here with screenshots as well. So again, plenty of information available through the help screen there. Again, there. Okay. And in addition, if I just go back to my PowerPoint as we begin to wrap up, just to mention, we do have a handy handout. If you already have a subscription to Health Business Elite and you want to promote this, raise awareness amongst your healthcare managers, your management teams, and so on, there's a link there to it and also a QR code which to scan to access that. And then you can download, print, circulate accordingly. Okay. There is also a trifold guide that's available as well. So if you currently have a subscription or you're thinking of taking one out, then also we provide these materials available. So these are available free through our EBSCO Connect portal in the promotional materials section. So again, you can scan that QR code to download that, and then you can print copies of that. Okay, again, circulate that either electronically or via print to your teams, etc. Again, part of the awareness raising and also supporting use of this. We do have our EBSCO Healthcare Training Resources portal with more information. So again, this gives you access or links to the training videos. So this one will be edited and made available through our EBSCO UK YouTube channel. There's a previous one on there currently if you want to review that, as there may be a bit of a delay with this one. Training sessions are also listed there. So for May, I'll be updating it, and also support information, including the handouts. Okay, so there are other links there for those who obviously in the NHS help on the hub. That'll take you to the NHS Library Service Desk in relation to the Knowledge and Library Hub, which is our EBSCO Discovery Service, and also EBSCO Academy provide links to other training videos, etc. as well. So EBSCO Connect is the main portal, connect.ebsco.com. So again, you can explore that in your own time. That does give you links to tutorials for using the EBSCO's interface. And they may be generic, not specifically Health Business Elite, but the principles will be applicable for using the new interface. And again, learning takes you to this page, which is EBSCO Academy, and that will give you additional videos in relation to specific aspects of EBSCOhost that you may want to explore. There are e-learning courses there, and also there are instructor-led courses, so that we're covering other products as well from EBSCO. So I'm going to stop here. Appreciate your attendance today. And also you can contact me directly at rcrooks@ebsco.com, and obviously wish you a good day.